To measure MP flexion, have the client seated with the elbow flexed, the forearm in mid-position, and the wrist at a 0-degree neutral position. The forearm and hand supported on a firm surface on the ulnar border. The axis of the goniometer is centered on the dorsal aspect of the metacarpal-phalangeal joint, and the stationary bar is on top of the metacarpal. The movable bar is on top of the proximal phalanx.
Measured range of motion is 100 degrees.
To measure MP joint extension, have the client seated with the forearm in mid-position, the wrist at a 0-degree neutral position, and the IP joints relaxed or in flexion. The forearm and hand are supported on a firm surface on the ulnar border. The axis of the goniometer is over the lateral aspect of the MP joint of the index finger. The stationary bar is parallel to the metacarpal and the movable bar is parallel to the proximal phalanx.
Range of motion is 35 degrees.
To measure MP joint abduction, have the client seated with the forearm pronated, the wrist at 0-degree neutral deviation, the finger straight, and the hand resting on a firm surface. The axis of the goniometer is centered over the MP joint being measured. The stationary bar is over the corresponding metacarpal and the movable bar is over the proximal phalanx.
Range of motion is 21 degrees.
To test MP joint flexion with IP joint extension, have the client seated with forearm in supination, wrist at neutral, and resting on the supporting surface. The MP joints are extended and the IP joints are flexed. The therapist sits next to the client on the side being tested. Provide stabilization over the metacarpals proximal to the MP joints in the palm of the hand to prevent wrist motion. Palpate the first dorsal interosseous muscle just medial to the distal aspect of the second metacarpal on the dorsum of the hand. The remainder of these muscles are not easily palpable because of their size and deep location in the hand. Observe the client flexing the MP joints and extending the IP joints simultaneously. Provide resistance to each finger separately by grasping the distal phalanx and pushing downward on the finger into the supporting surface toward MP extension and IP flexion.
With applying minimal resistance, the client will receive a grade of 4 or good, and with applying maximum resistance, the client will receive a grade of 5 or normal.
To test MP joint extension, have the client seated with the forearm pronated and the wrist in the neutral position. MP and IP joints are relaxed in partial flexion. Provide stabilization at the wrist and metacarpals slightly above the supporting surface. Palpate the extensor digitorum tendons where they course over the dorsum of the hand. In some individuals, the extensor digiti minimi tendon can be palpated or visualized just lateral to the extensor digitorum tendon to the fifth finger. The extensor indicus tendon can be palpated or visualized just medial to the extensor digitorum tendon to the first finger. Observe the client extending the MP joints but maintaining the IP joints in some flexion. Provide resistance to each finger individually on the dorsum of the proximal phalanx toward MP flexion.
With minimal resistance applied, the client will receive a grade of 4 or good, and with maximal resistance applied, the client will receive a grade of 5 or normal.
Provide resistance to the first dorsal interosseous by applying pressure on the radial side of the proximal phalanx of the second finger in an honor direction. The second dorsal interosseous on the radial side of the proximal phalanx of the middle finger in an honor direction. The third dorsal interosseous on the ulnar side of the proximal phalanx of the middle finger in a radial direction. The fourth dorsal interosseous on the ulnar side of the proximal phalanx of the ring finger in a radial direction, and the abductor digiti minimi on the ulnar side of the proximal phalanx of the little finger in a radial direction.
With minimal resistance applied, the client will receive a grade of 4 or good, and with maximum resistance applied, the client will receive a grade of 5 or normal.
To test finger adduction, have the client seated with forearm pronated, wrist in neutral, and fingers extended and abducted. Provide stabilization at the wrist and metacarpals slightly above the supporting surface. The condition is not palpable. The muscle cannot be palpated. Observe the client adducting the first, fourth, and fifth fingers toward the middle finger. Provide resistance at the index finger at the proximal phalanx by pulling it in a radial direction, with the ring finger at the proximal phalanx in an ulnar direction, and the little finger likewise. These muscles are very small and resistance must be modified to accommodate their comparatively limited power.